Now we shift into an essential conversation about women's health, mental, physical, and emotional well-being. Joining the Global Black Economic Forum stage for a Declaration of Independence discussion. Please welcome Dr. Davida Hunter-Cummins, founder, Aspire New Jersey Youth and TriSage Method; Dr. Topeka Sam, founder, CEO and visionary, Topeka K-Sam Ventures; and Dr. Janifer Tropez, assistant professor of obstetrics and gynecology at Tulane University. Our moderator is Dr. Judith Joseph, board-certified psychiatrist and researcher, Manhattan Behavioral Medicine.
Thank you. Well, thank you all for joining. Women's health is so essential, and we know from the data around the world that when women thrive, children thrive, communities thrive, economies thrive. But unfortunately, Black women struggle with really scary statistics. We have high rates of postpartum depression, maternal mortality rates, longer, worse symptoms of perimenopause and menopause, worsened symptoms and higher rates of fibroids, and yet we are the most likely to be underserved, although we have these high alarming rates. But there is hope. We have wonderful advocates and doctors and specialists here to dive into solutions. So thank you all for being here, and I'd like for you to share a little bit about your about your journey and why you decided to enter the women's health space. So we'll start with Dr. Tropez.
Good morning. So I entered into women's health because I had the opportunity to spend a wonderful week with Dr. Gwyneth Latson at Meharry Medical College, watching her take care of women in all sorts of ways. And I knew immediately when I finished that time with her that there was no better calling than to become a women's health provider. And so I get to take care of women, young girls, throughout their entire lifespan. And it's very dear to me. You know, before I'm an OBGYN and an educator, I'm also a woman and a mother and a sister and a daughter. And so this is very personal life work for me.
And Dr. Sam, tell us about how you entered this space.
Sure. So I started this work through my nonprofit, Ladies of Hope Ministries. We work to end poverty and incarceration of women and girls. And to date, now, after 9 years, we've been working with thousands of women across the country and in the Caribbean with helping with employment, housing, removing barriers, financial education. But there was one thing that seemed to be a major issue, and that was access to quality health care. And then through my own example, when I was incarcerated myself, and I ended up having uterine fibroids, it was incredibly difficult to get the care that I needed. And so my husband and I decided to create a solution and remove the barriers for people who are just as impacted, and that was how and why we created Epic Health. And so we're a telehealth platform, a telepharmacy, and we also provide mental health through our app, Epic Health PBC.
Thank you. And Dr. Hunter-Cummins, tell us about your work and how you got into this space.
Yeah, so my name is Davida Hunter-Cummins, and I am a licensed clinical psychologist. I got into this area of work about 25 years ago, and I was working with youth. And that was my main thing, just with youth, but their parents needed assistance. The mothers needed help as well. And I think that I started this journey just listening to them going through perimenopause and menopause and trying to help and trying to be there. But then when my own journey began through that stage of life, it became very real to me. And I looked for solutions and was unable to find them that really helped me. And that's why I came up with TriSage method. And it's been amazing the past 2 years. And when I've shared it with other women, they feel the same way. So, you know, that's pretty much part of my journey and why I became a mental health, a provider for women in mental health. It was for youth, but it's kind of transcended into this because of my own experiences in life and in perimenopause.
Well, these stories are important because we know that the outcome for women's health, for Black women's health, improves with Black providers, Black professionals. And having people that look like us is crucial. It's a key part of the solution. Now I'm going to ask the audience a question. How many in here know someone, or are you someone who lives with uterine fibroids? Raise your hand. Okay. And what about how many in here know someone or you're living with endometriosis? Raise your hand. Okay. I know someone too. All right. So that leads me to you, Dr. Tropez. Why is it that Black women get diagnosed later and have more severe symptoms? And what are some solutions to address that for these two conditions?
So the reason why we are typically diagnosed later and with worse symptoms is, number one, we actually have worse symptoms, okay? And they usually are misdiagnosed or missed over years. ACOG even showed in their recent guidance in 2026 because the pain is dismissed, normalized, or misattributed. Also contributing to that is, I think we think that it's okay to have heavy periods. It's okay to bleed through clothes. It's okay to have pain with sex. And none of that is actually normal. And those are the signs that you need to seek professional help sooner than later. I think we also have mistrust with the medical system, as well as like the options that are provided to us. Hormone therapy is essential, especially in both of those conditions. So I think it's also finding the right provider that you feel like you can trust, that resembles you, that you can make a plan together. I recently came across two specific platforms, Health in Her Hue and Fee Manual, which help women of color to better understand their bodies in different conditions. And I absolutely recommend becoming your own agent and understanding your body more and seeking more information.
There's also another organization, the White Dress organization, named because a lot of women fear bleeding and not being able to wear white. And it's a community. So I think community care is really important. And let's talk about the mental health implications. I talked about how women are afraid to wear white dresses. Dr. Hunter-Cummins, tell us about the mental health implications related to fibroids and endometriosis.
Well, I will speak to perimenopause and mental health and how, they're interchangeable, right? So, and they both should be treated, whether or not it's through menopause or perimenopause, or you're having mental health symptoms of issues in mental health. I know that in menopause, I can speak on my own, experiences with having menopause and feeling, and going out and reaching out to doctors and saying, okay, somebody's got to help me because I'm not feeling like myself. And then trying to prescribe maybe an antidepressant, but I wasn't depressed. And so I feel like for a lot of women, that's what they get, versus figuring out what the problem is, journaling what's happening to your body, sharing that information with the doctor. When you have this information to share with the doctor, I think that the doctor can possibly help a little bit better. But I also think it's super important that going through these stages of life, that you have a medical doctor, that you have a therapist to help you through it, because it can be very, very, it's a new experience. And there's, our mothers went through it, but they were quiet, they were silent, they didn't share about what happened. And so I think that this generation of women are more forward in telling what's happening to their bodies and what's going on and asking for help. And so for me, I feel like I don't want my daughters to have to experience this without any assistance. It's super important that they're always informed, that they always share what's going on with their bodies, and know that it's normal. It's a transition in life, and we all have to experience it if we get old enough, right? We all experience this. And I feel like mental health, and regardless to whether or not you're going through menopause, if you feel like something's going on, don't hold it, don't hide it, share it. Get a professional who can help you to go through it. That's it, yeah.
So yeah, Dr. Hunter-Cummins was saying that a lot of the anxiety comes from the uncertainty. So if you, let's say you don't expect to be having symptoms like bleeding or hot flashes or brain fog, that creates even more anxiety. But naming it and using tools to help you can actually help you to cope better. So it's not just medications, but there are different therapies and skills that you can use. But if you don't know about it, how can you prepare, right? So thank you for that. Yeah. Dr. Sam, you work with a lot of people who are underserved and feel as if they're sometimes misdiagnosed, underdiagnosed, not given the correct supports. How can people advocate for themselves, especially with these women's health conditions that we talked about?
Yeah, I mean, you know, it is, your voice is the one that matters. And like Dr. Cummins said, that it is important. You have to always, when you feel something's wrong with your body, it doesn't matter what situation that you're in, whether it is a prison, whether you're unsheltered, or whether you have quality health care, you have to let the professional know that something is going on, and you cannot wait. When I spoke earlier about my fibroids, for example, I had incredible medical insurance. I had incredible doctors. I went and saw my gynecologist regularly, so I knew going into prison that I had uterine fibroids, and I was actually scheduled before my arrest for a laparoscopic myomectomy. Yet when I got in, I was facing 10 years, and the doctor told me, well, you'll be in here 10 years, and you won't have children by that age, so you might as well get a hysterectomy. And it shocked me because, one, I knew I didn't need that, and so I was like, well, wait a minute. I need to get a second opinion, but they wouldn't let me. And I actually ended up going to the SHU, which is a special housing unit, because I made a call to my doctor to try to get additional help and additional support. And so another reason why we had created the platform for Epic Health is so that people have the ability to speak with other professionals that are culturally competent, that understand what a person is going through, and not treat them differently irrespective of their circumstance. So I think it's critical that you understand that no matter where you are, your voice matters. And that if you don't take care of yourself and your body, no one else will.
That's important. If you didn't advocate for yourself, you wouldn't get the adequate treatment. And you know, we're fortunate to have a doctor on stage who does provide adequate treatment. So if someone were to come to you and say, my doctor thinks I need a hysterectomy, or they think I need all these procedures for conditions like fibroids, et cetera, what should they do?
So your first action plan should actually, like I said, do some of the research yourself, you know, explore some of your options. When you get physically in front of the doctor, you want them to explain their thought process. Have them provide that differential diagnosis and what the plan of action will be at each step. Personally, I show this to patients on the computer real time, especially when we're talking about menopausal treatment. It has to be individualized. And so I say, this is what you're experiencing. You've given me this composite of symptoms. So this is what I think is happening. Now, the different treatment plans, it's vast. And so we're gonna try this first. This is what's absolutely recommended first line. And then if that doesn't work, then we're gonna switch to this. So we're gonna see each other a lot until we get this right. So be it via in person or via telehealth, we're gonna continue to work on this plan together. And I try to give them the algorithm of what we're going to do step by step so that they don't have anxiety about, well, what next? Is there no more action? Is this just not for me? Because there's always a treatment plan that's perfect for you. When it comes to treatment for fibroids and endometriosis, you definitely should obtain at least 2 or 3 opinions with various surgeons if you're down the path already of surgery. But there are many options, medically speaking, prior to getting there. We have hormone therapy, we have IUDs, we have GnRH agonists and antagonists to sort of help calm down fibroids as well as endometriosis. And so there's, like I said, there's an option for everybody, but it has to be a bidirectional relationship with you and your provider that comes up with a plan that works best for you. Now, in some instances, you know, a hysterectomy really is, it is the last resort, okay? And ultimately, we think of the uterus as a non-essential organ. You know, that's easy to say if it's not yours, but I consider everything that I have in my body essential. But at the end of the day, if you are having bleeds to the point where you need blood transfusions, you're in the hospital, you may have outcoursed all of the other options besides a hysterectomy. So that's why it's important that when you see these symptoms early on, you seek care early and often, and either help delay the progression of the disease or condition, and or even prevent it up front.
So there are options, like the doctor laid out. And you mentioned hormonal health and the fact that women have options for support. Black women are more likely to have hot flashes. They're more likely to have longer symptoms of perimenopause and menopause, earlier symptoms, more severe symptoms. Yet many times we're taught, well, everybody goes through perimenopause and menopause. What makes you so special, right? Dr. Hunter-Cummins, what are some of the mental health symptoms that we should look out for in terms of perimenopause and menopause, and how can we support them?
So I think first and foremost is sleep. I think a lot of women come to me and say, I can't sleep, or I'm up at 3 a.m. and I can't go back to sleep. And so my first thing that I recommend is, okay, so we need to journal this. Journal what time you're getting up. What are you doing during the day to help you, feel better? And a lot of times because they can't sleep at night, it's hard for their days. Their days are difficult. So my suggestion is always to see your doctor to get a prescription for some sort of hormone that gets you balanced. Your diet should be really, you can't eat all the junk food and things that make your body not feel good. Also, I think getting rest, getting exercise, doing all those things to help your mental health, I think makes a huge difference. I think journaling is super important. That's part of the process with TriSage, is we ask the ladies to journal their symptoms, everything that's going on, so that they can be aware of things that are happening. So sleep, brain fog is another thing that they say, oh my gosh, I can't remember this, I don't know what's going on. But when estrogen declines, it's cognitive, right? And so you're not thinking the same as you would normally. That's another symptom. What else is it? But the two things that are most prevalent for many of the women that come to me is
you were saying mood too. You were saying earlier
mood.
that a lot of people were getting prescribed antidepressants, and you were
right. And they're like, I'm angry. They're like, I'm angry, but I don't think I'm depressed. And it just comes and goes. But it's all symptoms of perimenopause and menopause. Those are those symptoms. And so I think that it's important that, like I said, you visit your doctor, you come up with a treatment plan that works best for you. And it's not one size fits all. Like, everybody is different and everybody needs something different. So it's important that, you have that relationship with your doctor and make it work for you. And it's not, it doesn't last forever. And once you get on the right plan and you have that treatment and it works, give yourself a couple of weeks and then it works. And then you're like, oh, this really makes a difference. So, and I know that a lot of women are afraid of, and this is my mother's generation, they were afraid to use hormones because of, they were synthetic and they didn't, they caused cancer. But things are different now, and so we're not using those same hormones that they once did back in the 70s. And so I think that the relief that comes from using it makes a huge difference.
Yeah. You want to add to that, Dr. Sam?
I do want to add to that. So when I started perimenopause, I didn't know, and I was talking to Dr. Cummins about my symptoms. And she said, I think maybe you're going through perimenopause, and so then that's when I started taking her product, Novara, and immediately it changed. I mean, my husband saw a difference. I was completely evil and mean, and then all of a sudden, I was happy-go-lucky, and he was thankful for that. But I think, part of it, we don't know, right? We are told, and I say we as in Black women are told to, if you're struggling with something, to pray it away. which is why we don't talk about mental health, which is why we do not go to different professionals to seek help. People don't have access to quality health care, so they can't. People are embarrassed about having the conversations that they're going through. And so I think it's really, really important now, today, that these conversations are happening, specifically within our community. And again, when you are in these vulnerable situations, unfortunately, a lot of your choices are taken away from you. The only choice you do have is your voice. And so it is just critical that you're asking the right questions to even one person if they'll listen, because that person can give you, like my friend did, advice to let me know what I was going through and put me on the plan that I needed to take the right product and do what I need to do.
Yeah, it's really important to know what the symptoms are, because you could get misdiagnosed. And that's why, I developed a system called the TIES method. T is thinking. So if you're having memory problems, thinking problems, it could be due to hormones. The I is identity issues. Do you feel like you're not yourself anymore? The E is emotional issues. Are you moody, irritable, sad, anxious? And the S is sleep. TIES, TIES. So that way you know, possibly this is due to hormones, and let me get the appropriate help. I'm going to ask each of you one thing you wish that all women knew. I know it's a big ask, but just, down the line. I'll start with you.
So I think one thing that I wish all women knew is that menopause is normal, and it is a transition. And it happens over sometimes 2 decades. Okay, so, and it is the end of one era and the transition to another, but there's many stages to it, and that they oftentimes miss all of the symptoms early on because you might begin them in your 30s and you're not even thinking about that's what's happening. So as Dr. Hunter-Cummins stated, it's really important to create objective data for yourself and for the doctor. So if there was one thing, is that have the data, write down your symptoms, track it, always know your period, track when your period starts, ends, and the quality of the symptoms when you have them. So, and just track that down, journal.
I love that. Write it down. You are the best historian of your own personal history. You come to the doctor with that list and you know what you're talking about, you're actually an active part of the treatment plan. Dr. Sam?
Okay. Look, repeat the question for me one more time.
What should all women know? If you could list one thing every woman should know for their for women's health.
For women's health. I think I want one. I think what I would like every woman to know about their health, again, underscoring that this is your body, and no one knows your body better than you do. No one, not even your doctor. You can tell your doctor what you're going through, but your doctor can't look at you and say what's happening. So as long as you know, you can take that confidence, because you know it's my body, I own it, and so therefore I know when something feels wrong. A person cannot tell me that what I'm feeling is not so. And challenge it. And if you're not getting the answers that you're looking for from your particular professional, find another one. That is also your choice and your right.
There's only one you, right? So you have to advocate for yourself. You have to look out for yourself. Dr. Hunter-Cummins, what's one thing that you wish women would know?
And I believe mine is on the same theme. You can't be quiet about what's happening to your body, right? Because when you're silent, you erase everything. And so you have to speak up, let your doctors know what your body is going through, and don't pay the price of silence, because everyone, we can help, right? There's help out there. You don't have to live through this and be embarrassed by going through perimenopause. It's aging, but it's okay, and you can come out on the other side much better if you share and if you do the things that make you feel better, and that's getting help. Yeah.
I love that. Unfortunately, women often do things alone, right? We feel as if we don't want to burden others. Other people depend on us. Many of us, in midlife, we're taking care of our kids, we're taking care of our parents, we're the rock. But if you don't take care of yourself, how are you going to take care of others? And you're worthy of your own joy. And I see that there are some men in here as well. And I like to ask this question, if we have time, but what are ways that men can support women's health issues? I'll start with you, Dr. Sam. Because I heard you talk about your husband.
My husband's not here right now, but I'm sure that he would laugh and just be like, ignore her. But the way that men could help support us is just understand, give us grace. That's what I'll say. Those hot flashes are nothing to play with. 1 minute we're cold, the next minute we're hot. The mood swings, I know, we love you. Just give us all the grace possible. But also, I think, in all fairness, just educate yourself also on what menopause is so that you have an understanding, because you may even notice symptoms and changes within your partner that they may not even realize what's going on. And also, for men, not that this was the conversation, but also men too should check their own hormonal health as well.
I love that. Yeah. Dr. Tropez?
I mean, be an advocate for the women in your life, legally, through policy, through your voting capabilities. Speak up for women amongst other men. Raise young men to be more aware themselves. Understand women's bodies. Don't just dismiss it as, oh, they're on their cycle, their hormones. Women's bodies are extremely complex, way more complex than men's bodies. Let's just say that. And so we have these life cycle changes that do put us through some compromising situations sometimes with our relationship. And like they said, give us some grace, but also take the time to learn about it. But most importantly, I have to say, be our advocate, in policy, and when we're not around.
That's right. Educate yourself. And Dr. Hunter-Cummins?
And I feel the same way. I think that men, we run the house, right? We really take care of everybody. And so to have men understand what menopause is about and how to support your significant other, I think it makes a huge difference. So I think men should educate themselves on it and talk to your friends about it. That's something that's super important, that they have those conversations with other men about what's going on and support each other, because it's difficult. During menopause, there's a such thing as divorces, right? So there's a high rate of divorces during menopause for a lot of couples. And so I think that if they're educated about what's going on, they won't take it so personal, and they would help their significant others to get through this transition.
And I met your daughter backstage. How can we talk to our kids about it? Because they're going to go through it.
Oh,
you can't outrun menopause. You can't outrun perimenopause.
Yeah, my daughters know what it is, and it's no quiet. We don't keep any secrets. Everything is, upfront and personal, so that when they're making that transition in their life, they'll know how to handle it and they'll be well prepared. So it's super important to share, even with your children, what you're going through. Yeah.
I think secrets can really hurt us in the Black community, because if we don't talk about it, so many of my patients say, my mother never talked about that. My grandmother never talked about that. So when you're trying to get a family history, like, okay, when did your mom go through this? I don't know, they never talked about it. And there's also so much misinformation, and I think it's important to highlight that study. And I'll ask you, Dr. Tropez, to take us through the data that, I think has led to women not getting the medical treatment that could actually improve their quality of life and also extend their lives.
Do you mind if I speak on it just for a little bit? So the study she's referring to is the Women's Health Initiative that came out in 2002. Prior to that, women were receiving hormone replacement therapy regularly. That data was wildly misinterpreted, just to be explicit with how we got here and what we're going to do about it now. There is a segment of time in which hormone replacement therapy is absolutely safe, and that is in the perimenopause transition, as well as up to 10 years after menopause, that final menstrual period. What the study highlighted, unfortunately, was that women in their 60s who were started on combined estrogen and progestin therapy had increased risk of heart attacks and strokes. Well, that's not really the way we practice in treating menopause. We treat women in their 40s and 50s with hormone replacement therapy. And what that does long term actually helps to prevent some of the things that those women who are receiving menopausal hormone replacement therapy late in their 60s to mitigate. So for instance, over those 10 years, women catch up with cardiovascular disease risk that is the same as men. Over those 10 years, they increase their risk of colon cancer, and breast cancer. But if they were started on the hormone treatment before, then all of these things are actually mitigated. Hormone replacement therapy has a ton of benefits, which I don't think are highlighted enough. They prevent osteoporosis. They prevent colon cancer. You know, so we don't talk about all of the good parts of it. They have not been able to prove that it specifically prevents dementia, but it does help with mood as well as like the brain fog. So I just want to highlight one other quick thing that also came out of that time period was this term bioidenticals. So bioidenticals is a branding terminology. Often the FDA approves hormone replacement therapies are bioidenticals also, and that's the first line recommendation for treatment. What I don't recommend is that people get off-label products, things that are not like regulated at all, because what we don't want is you getting unopposed estrogen. This is my main point today. If you have your uterus, you need estrogen and progestin. You cannot go around obtaining unopposed estrogen, which can lead to you having breast cancer and uterine cancer. So that's my main point today. Hormone replacement therapy is absolutely safe when started in the transition of menopause, and that if you have your uterus, you need both estrogen and progestin. If you don't have your uterus, you can just have estrogen.
And you also mentioned the physical health benefits that can extend life. Osteoporosis, women end up, breaking their bones, breaking their hips. Things like urinary tract infections. I used to work on a geriatric unit, and a lot of times people would come in with these bacterial infections because had they gotten the hormone therapy, perhaps they could have prevented that. That's why one of the most common things that you see as you age is you have to go to the bathroom a lot frequently. Well, because hormones don't just impact your ovaries and your uterus, they impact every cell in your body. So that creates these changes. And so this could be life or death, but that's why we have to have these conversations so we have access to this information. The one thing that we really didn't touch on that much was the high rates of maternal mortality. And we talk about women's health as being essential. Well, this is essential for our livelihood, for our generations even existing. So I'll start with you, Dr. Hunter-Cummins. Tell us about some of the rates that we're seeing and things that we can do to address this.
I'm sorry, could you repeat that?
Oh, the high maternal mortality rates. How can we advocate for ourselves?
I think it's important that, like we talked about earlier, like just being present, sharing everything with your doctor. I think that the infant, you said infant mortality,
Yeah,
right?
maternal.
Maternal. I'm sorry.
Hold it up higher.
I'm not so well versed on that, so maybe we pass that.
I mean, what can we do to advocate for ourselves if we're feeling as if our doctor isn't listening to us, if we're concerned about that?
Well, I think that that's super important, that if your doctor is not listening to you, maybe that's not the right doctor for you. And you need to find someone who does listen, who does, connect with you on that level. And I think that even in my own experiences with gynecologists, I didn't connect with a few, and it didn't work, and they didn't tell me, and not that tell me what I wanted to hear, but I don't think that they were actually hearing me. And so I think that it's important that you connect with a doctor who hears you, who understands you, and who you can connect with in order to make a great treatment plan for you. So
I was going to say, we use this terminology called cuss. So if everyone learns how to cuss when they go to the doctor, and C stands for I'm concerned. U is I'm uncomfortable. All right? And then S is like I'm worried about my safety, right? And then always bring an advocate with you. Always have someone there with you so that they're hearing this information also when you're in the presence, especially when it comes to like the maternal mortality.
I love acronyms. That's a good one, cuss. I'm gonna remember that one.
You got two today.
Dr. Sam.
Yeah, I mean, again, I'll just speak from women who are incarcerated and the maternal morbidity rates there. There are so many women, unfortunately, when incarcerated, they are shackled during child labor. We passed over 20 pieces of legislation nationally to end shackling during child labor for women who are incarcerated, and made sure that it was put in the dignity provision in the Federal First Step Act. But that was because women were dying right? People don't care about women who are in prison, and then especially a pregnant woman in prison. And so, and a black woman in prison, right? So you have all these compound barriers in these different situations and circumstances, and we just don't get the proper care. And so while I don't have the exact rates and numbers, we know because we see it every single day that black women are dying during childbirth. And it isn't because it cannot be prevented. I would err to say that a lot of it happens because they don't have the right professional, a person that looks like them, that cares about them, that understands their body, who they are, and respects it. Because when we're not respected, the doctor will not take care of us in the way that they should.
And you don't have to do it alone. There are several groups out there. Sometimes we feel like we don't even know where to start. We go to our doctor who's supposed to take care of us, and we feel rejected, we feel unheard. But there are so many groups of women and advocates out there. So, just to share some of those resources so that you have those with you, I'll just go down the line. If you could share some women's health resources that people can utilize, both either nationally, locally. I'll start with you, Dr. Tropez.
Oh, yeah, certainly. I'll say it again. It was Health in Her Hue, and then also Fee Manual. Those were the two.
But I would say Epic Health, PBC, if they go there, we have a host of resources depending on the state that you're in, so you can find something local that can help you, and then TriSage.
And I would definitely say TriSage method. There's a host of products that you could use and information on perimenopause and menopause.
I add something to that. Let's Talk Menopause. It's an advocacy group that I'm on the board of. And I think that everyone can get involved by writing to your local leaders, by getting involved with organizations that create positive change. Women were not included in clinical studies until the 90s. So a lot of the science out there isn't based on our bodies. And so we really have to advocate for this change so that we get evidence-based care because we're worthy of that. And I'll give you all one last chance to touch on anything that you'd like to discuss that we didn't talk about women's health. I'll start with you, Dr. Tropez.
I guess my last words would be to know the language that you need to use to go into the doctor. Like I said, provide that objective data, for yourself as well as a doctor, not that it's just like random recall, because we often don't recall things the way it actually happened. And then always ask about what's the whole plan and what's your differential.
I love that. Dr.
Me?
Sam? Yes.
I would just say, we've all said a lot here. All the information that I've shared today, you can find on our website, epichealthpbc.com or thelohm.org.
Dr. Hunter-Cummins.
Yeah, I'm a big advocate for journaling, right? So I think that women should journal these moments that they're having because they slip and then we forget. So I think that every symptom that you have, I think even journaling for food, everything that you're doing and putting in your body, I think it's important that you journal. And again, TriSageMethods.com if you want to visit us and see what we have in store. I think it's a great way to approach perimenopause and menopause.
And I'll add something that I tell all my clients. Number one, do your research before you go to the appointment, look it up. Educate yourself, and that way you have an understanding. Science shows us that when we don't know something, we get stressed out. If something's uncertain, we don't think as clearly, we don't make good decisions. So educate yourself beforehand. Number two, like what Dr. Hunter-Cummins said, take a journal, write down your symptoms. What did you eat that day? The day that you had hot flashes, the day that you had brain fog. Who were you around? Were you stressed? What was your sleep like? And then lastly, when you go to the doctor's appointment, have a clear goal. Know what you want when you leave. And if the doctor is not meeting that goal, then get a second opinion. Please give our panelists a round of applause. And thank you so much for being curious today.
Thank you.
Thank you.